What is the role of the kidney in blood pressure regulation? Part 1. The kidney plays a role in hypertension. A researcher published to date about 200 years ago is known that abnormalities in the production of urine by the kidney alter the blood in a way that increases vascular resistance, leading to high blood pressure and the enlarged arteries mass. Several years later, Harry Goldblatt induced fatal hypertension in dogs by rupturing one of the renal arteries. Arthur Guyton and his colleagues hypothesized that the kidney controls blood pressure levels in the 1970s by controlling the amount of extracellular fluid. They argued that the combination of dietary intake with urinary excreta of salt and water normally reached equilibrium, leading to a constant volume of single-cell fluid and blood pressure. They reported that when blood pressure increases for some reason, the perfusion pressure of the kidneys also increases, increasing the excretion of sodium and water, which Guyton called pressure natriuresis. What is the role of the kidney in blood pressure regulation? Depending on the ability of the kidney to excrete sodium, this mechanism that alters blood pressure is of sufficient benefit to increase peripheral vascular resistance to limit the intravascular volume, and consequently, decrease blood pressure in response to a range of stimuli at frequencies, higher heart rates. It should be in addition, an allowable pressure modification. The natriuretic response presumably requires maintaining a chronic elevation of intra-arterial pressure, leading to a high equilibrium point in blood pressure for salt and water excretion. It moves. Furthermore, a series of kidney cross-transplant studies have supported an important role in the intrinsic functions of the kidney in the pathogenesis of hypertension. Genetically compatible donor and recipient strains were used to avoiding rejection, with the elimination of both native kidneys so that the transplanted kidney provides full transplant function. Similarly, studies of spontaneous hypertensive mice and compatible hypertensive mice have rewritten these findings. The same principle is valid in humans where resistant hypertension can be reduced after a successful kidney transplant. Collectively, these studies point to the fact that decreased kidney excretion of sodium leads to hypertension. Blood pressure and hypertension. Hypertension is one of the most common chronic diseases in humans, affecting more than 1 billion people worldwide. Although high blood pressure generally does not cause obvious symptoms, the consequences of chronic hypertension, including cardiac hypertrophy, heart failure, stroke, and kidney disease, are responsible for considerable morbidity and mortality. Treatments that effectively lower blood pressure can prevent these complications. However, in recent times, blood pressure dropped to target blood levels in less than 50% of patients who received treatment for hypertension, and the rate was less than 40% in people with chronic kidney disease, ERC. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.